By late April, Brazil was the most impacted country in South America from COVID-19, the majority of its cases occurring in its capital, Sao Paulo. With the city under quarantine, delivering crucial medical equipment and services were creating big challenges. Michelle Rodriguez is a GE field engineer that grew up in Sao Paulo, and she's been supporting the city's frontline workers with medical equipment. This is what Michelle said about conditions on the ground. Hi, Michelle. Where are you and what's your role?
Okay, I'm a field engineer for GE Healthcare here in São Paulo, Brazil. And I work with field services. I work with maintenance, basically installation, periodic maintenance, corrective repairs for imaging equipments, such as MRs, CTs. And I also work with a particle accelerator.
What is it like in Sao Paulo at the moment?
Well, São Paulo, I think it's the epicenter of this pandemic here in Brazil. So we are facing some restrictions due to the quarantine. And I think that changed a little bit our way to work, because we have to keep ourselves safe and keep the equipments clean and everything clean, not to spread the virus.
And how has your role changed, Michelle?
But it changes in the way, for example, now our imaging equipments, they are being used to diagnose, the COVID-19. And then we are facing a shift of patients. Now we are facing much more patients with respiratory problems.
What is your work tempo like?
Yes, we are working around the clock. The huge impact in that is that we are trying to work with a team. It's a very solid team. We have a huge service team here in São Paulo. It's a planning. Before we start working, we have to plan the whole day if we're going to go inside a healthcare facility.
You're right at the epicenter in South America, on the front line.
Yes, a lot. You have to be brave every day, because you are doing a job that cannot stop. You cannot stop servicing healthcare equipment. You cannot stop people from needing those equipments. You need to ensure you perform an excellent service, so the person who will need that equipment will have it available.
I believe, Michelle, you had to actually stop traffic in one particular case to deliver equipment.
Yes, we had to stop traffic and close the street, because we had to lift those equipments into the 5th floor of the building. It was just, I think, a huge thing we did, because we have a big traffic. We have buses passing. We have people going to the hospital on that street. And it was a very huge project.
When it's delivered, it must be a pretty good feeling.
The deliver of an equipment that can help somebody and help somebody to save lives, help somebody to get better. It's very gratifying to do our job. I think it's the best part of our job, to know that you can help some way.
Thank you, Michelle. Be safe.